Good morning. This is Faith in Our Hometown, brought to you as a community service and sponsored by Mercy Hospital, Joplin. And now, here's your host, Father Jay Friedel.
Good morning and welcome back to Faith in Our Hometown, our weekly conversation about issues that kind of matter to us here in the Joplin area, and especially as it might matter to us even as people of faith. This morning my guest is going to be Brian Colby, who's the Special Projects Director for the Missouri Budget Project. Now, some of you might want to turn off the TV now. I hope you don't, all right? Again, we're trying to model that we can have conversations about things that might otherwise get tense. And today we're going to be talking about things like what happened with the Affordable Care Act and where we might go next. So if that's going to raise your blood pressure and ruin your Sunday morning, well, have a cup of coffee with somebody else today. But otherwise, we're going to try to talk about it. We're going to try to talk about it in a way that is pleasant. We might have some disagreements. But what the heck, we are going to go ahead and just wade there anyway and hope that with each other we can have a nice, friendly conversation about things that we might even differ about that might move us forward. Please stay tuned. We'll be right back after this Mercy Minute.
Once I quit playing football, I still kept up with the eating, the amount of calories I wasn't exercising, so the weight started adding on. Dr. Lou is very knowledgeable in the work he does. He also has a program set up that has support systems in place for you. You'll go through the seminar at first. He'll give you the different examples of surgeries you can have to see which one works best with you. He will also sit down with you and discuss the options, what he feels, but he'll work with you the entire time. Mercy has their gastric bypass program here. They have all kinds of resources and support systems in place. They want to see you succeed, and they're here to help you the entire time, even after the surgery.
So welcome back this morning. As I mentioned to you earlier, my guest is Brian Colby, who's the Special Projects Director of the Missouri Budget Project. So first of all, Brian, tell us a little bit about yourself.
Sure. Well, thanks for having me. I appreciate being here today. Well, my name is Brian Colby. I live in Kansas City, but I work in Jefferson City when this legislature is in session. I work on health policy and budget policy for the Missouri Budget Project. And the Missouri Budget Project is a think tank that analyzes revenues and spending in the state budget.
Okay. Well, see, I'm glad you're here this morning, because the deal is that sometimes I think we need to wade into these topics as people of faith, and sometimes, me and my other ministers, we're a little chicken. We don't like to wade in there because we don't like to upset the people that we preach to or any of those things. And I think it is fair to say that we can reasonably disagree on the approaches to some things. And I just think we ought to be able to have a conversation without getting hostile with each other, even though we might hold strong beliefs on one side of something or another about how to accomplish something. Now, in recent history, of course, there's been a lot of controversy about the Affordable Care Act. It was controversial when it was passed, and it stayed controversial. I think that everyone from the very beginning, including the people who were so dead set on it at the very beginning, said it had problems and it needed to be fixed. Well, we never fixed the problems. And so, with recent legislative issues and attempts to change the law to kind of get rid of the Affordable Care Act, repeal it, and then enact something new, well, that kind of crashed and burned.
Yeah,
okay?
it sure did.
So now, where are we? Where do we go from here? What are we looking for? What are we hoping for? And again, what kind of an effect is that going to have for us here in Missouri?
Sure. Well, we don't really know exactly where we are. What happened was that Paul Ryan and the president worked together to put together a package that would repeal some parts of the Affordable Care Act. It left in place a lot of the Affordable Care Act. And that was probably part of the problem with repealing it altogether, is that it didn't actually do the repeal. And so some of the conservatives, especially those in the Freedom Caucus, they didn't like the bill.
Right.
The bill also cut back on Medicaid. Medicaid is our program that provides health care for low-income seniors, children, and people with disabilities.
And it was originally intended to make sure it was going to take care of all the people who fell through the cracks.
That's right. That's right.
Okay.
Well, the Ryan bill, or the American Health Care Act, as it was called, cut back on Medicaid pretty significantly, and would have reduced the payments from the federal government to the state to help pay for the program by about 25% when it's fully integrated after 10 years. It's about $1 billion. It really placed a great deal of burden on the state of Missouri. And so some of the more moderate Republicans and of course the Democrats objected because of that reason.
Sure.
And so the deal fell apart. Where do we go from here? It's kind of hard to say. It's very difficult to get a bill passed through the House and the Senate with agreement, especially with the rules of the Senate. It's very, very difficult. And as of right now, it doesn't look like they're going to be able to get to 60 votes and have Democrats participate in a bill. And so they can either try to cooperate with the Democrats or go on to something else. And it looks like right now they may be going on to something else.
Well, I know that there are some people who are hoping that a more moderate cooperation between both sides of the aisle, if you will, are going to be able to prevail, but they're just wondering whether or not they're going to get any traction.
That's pretty much it.
Yeah.
And some of the problems with the Affordable Care Act, it tried to fix the problems in the individual health insurance market. Before the Affordable Care Act, you could get denied for a pre-existing condition. You could have an annual lifetime or lifetime limit on the amount of insurance that you would receive, the health care that you would receive. So a lot of people who even had insurance were ending up running out of their insurance and being on the hook for huge medical bills, or people that had some pre-existing condition were being denied. So they tried to fix that problem.
Right.
And in fixing that problem, it caused that market to be more expensive.
Sure.
And when it was more expensive, young, healthy people didn't sign up. Only the sick and the older people, and that made the cost rise.
Right.
It went up.
Yeah, and again, the Catholic Church, of course, had problems with the Affordable Care Act, not from what it was trying to fix, but some of the other things that it also included that we weren't in favor of.
Yeah.
And so this time around, again, we were kind of like saying, okay, we really want to get rid of those things we're not in favor of, but we're really not in favor of, losing insurance for all these people who are uninsured or underinsured to begin with. So again, we were, kind of in some ways hoping for a medium ground. So right now, in some ways, I guess we got some of what we were looking for, because we were at least trying to force something that would try to be a middle answer.
Yeah. And I understand the Catholic position. I'm Catholic myself. I worked very closely with the Catholic Conference and understood. My father was director of Catholic Charities for years.
Oh, there you go.
So I understood where they were with the law. They tried to make some special arrangements. Some of these had to be litigated. But I think what we're talking about now is really changes to healthcare to the poor, and whether or not we want to spend that money from the national level, continue the partnership at the state level to provide needed programs for low-income seniors in nursing homes, in-home care, people with severe disabilities, children with head injury or severe autism, and low-income, low-wage kids. We have about 1 million people on Medicaid here in the state of Missouri. It's a $9 billion program. It helps very, very sick and challenged individuals. And I think as a state we need to, and as a nation, need to make up our mind. Are we going to continue this program? Are we going to continue to help the older Missourians with very limited incomes and kids and pregnant women enter this world in a healthy way?
Yeah, and I mean, and it's this is tough because again, I understand the challenges, and this is one of the reasons why I'm not a legislator.
Yeah.
Because I have not been able to figure out, of course, all the solutions to these. I keep waiting for somebody to come up with a solution that I can really get behind and push for, because everything seems to have problems one way or another. But I know that some way or another we're going to have to figure out. And I think you hit the nail on the head there, saying, well, what is the role of government? What is the role of what's my duty as a taxpayer?
Yeah.
And I, of course, nobody likes to pay taxes. I get that, and I don't pay that much because I don't make that much. But I do understand that nobody likes it.
Yeah.
But at the same time, I don't ever hear anybody talking about the fact that sometimes paying our taxes is a sacred trust. That in some ways, I mean, at least the way I see it, I do pay my taxes hoping that the government is going to do some good for all of us, for the common good, that I wouldn't be able to do by myself.
Yeah.
Now, yes, I believe in the role of charity, okay, and I believe that sometimes, we as churches and things ought to step up into certain areas and things like that. But I sure don't want to be trying to step up into healthcare because I don't know what I'm doing with healthcare.
And it is complicated. I think a lot of people have kind of an idea of the Medicaid program is a program for people that don't want to work, people with low incomes because they're not trying very hard. But there are very few adults, able-bodied adults on Missouri's Medicaid. Our Medicaid program's really seniors of very low incomes, that most of which have burned through their savings for long-term care or for hospitalizations or what have you, and they've had to spend down their assets. And then they qualify. Or people with very significant disabilities, people in wheelchairs, but also people with real significant drug or alcohol problems. They also have to be very, very low income. They have to be actually below the poverty level, 85% of the poverty level, just to qualify for the program. And then we have children. Children we're most generous with, but for the most part, it's low-income kids, low-wage kids that don't get families' insurance. And yeah, we think it's a good idea to make sure that they stay healthy. We know if they do have insurance, CHIP or Medicaid, whichever kind, they do better in school, they miss less school, they graduate high school at greater rates, make more money as adults. And all those are studies borne out by Missouri when we implemented our CHIP program back in the 90s. We studied before and after and found out it just has a really tremendous impact on kids. And so, if you loved your grandma and you like babies, and you like children, this Medicaid program is a good program.
Who out there is going to argue with that? Okay, who doesn't like their grandma? And I guess there may be a couple, but who doesn't like babies? All right,
Exactly.
And I agree with you. I do think in terms of those are dollars for us that I just don't know that we have any choice but to spend some of those dollars, and that gets tricky because people say, well, then how are we going to afford it?
Sure, and the people in Jefferson City, the legislators that go there are doing tremendous work because the budget in many ways is a set of priorities. Some people call it a moral document,
right.
But it's not unlimited. And so it's a very, very difficult task every year to go back and try to figure out how to pay for roads, prisons, health care, and education.
Right.
And so it's always a very difficult task. They go through a process, it's transparent, it's clear, and they're doing the best they can.
Right.
And what we like to do at the Missouri Budget Project is show with real data the impacts of participating one way or another in a program, looking at revenues, making sure they're coming in at a rate which supports our spending, and help them make the very difficult decisions that they have to do in Jefferson City. And I'll tell you, it's tough. They put in long hours. They all work very hard. They study hard. And I'm very impressed with our folks, both in the House and Senate, that work on the budget.
Well, we've got some great legislators from here in our area, and I do know that they work hard, and I do that they keep trying to do the will of the people who've elected them. And again, how do we balance that budget and still pay for everything and figure out how to do all of it? I'm talking this morning with Brian Colby, who is the Special Projects Director at the Missouri Budget Project, and we have been talking a little bit about how we're going to proceed forward with the state. After a break, we'll probably be talking a little bit about where at least Brian or this particular think tank thinks we might be headed. And in the meantime, this is Faith in Our Hometown. Please stay tuned. Don't go away. We'll be right back.
You're watching Faith in Our Hometown on KSN TV, brought to you as a community service and sponsored by Mercy Hospital, Joplin.
So welcome back. Thanks for sticking with us. I hope you're still here. Again, my guest this morning is Brian Colby, who's the Special Projects Director at the Missouri Budget Project, which is kind of a think tank. I asked you before the show, it's just like, does that mean that everybody on the right and the left is upset with you for making your suggestions? Or
From time to time, yeah.
Okay. Then I like you. If you're in the middle and everybody's a little bit upset with you from the right, then that's probably a good spot to be.
Well, what we try to do is come from a point of view of the numbers, and always have the right numbers. The worst thing you can do is come with bad numbers or bad math.
Well, they're going to not listen to you if your math's always off.
That's right. And that's one of the things we always want to stay true to, is making sure that we're seeing revenue coming in at rates that we expected, and being very, very clear on what certain programs mean to the state. Oftentimes, I deal in healthcare, but it's in other ways as well, that the state partners with the federal government. And oftentimes we can take advantage of programs and bring in federal money to the state to help with either roads or healthcare spending or education. Healthcare spending by far is the biggest program that the federal government funds. Our Medicaid program is a large program, and we use about 50% for federal funding, and about 17% of general revenue. The other is provider taxes and other funds. So provider taxes and other funds in the federal government actually pay for 83% of our Medicaid program. And 17 cents of every dollar comes from the state general revenue budget, that budget that is not restricted in one way or another. So it's an extremely good deal for the state of Missouri, and we think that protecting that is a good deal. And it's a good deal for other parts of the state budget. If we only have to spend 17% on general revenue to support our Medicaid program, that frees up a lot of dollars for education and for other priorities. And so we say maintaining that relationship with the federal government, maximizing the federal dollars as they are afforded to the state of Missouri is a good thing, and maintaining our provider taxes. And the provider taxes, what I mean by that is that the hospitals voluntarily tax themselves, and they put that money forward to pay for our Medicaid program. So the federal government, the provider tax make up a broad part of paying the bills. And then we just have to come up with about 17 cents. And so that's a pretty good deal.
Now, you'll hear sometimes folks talk and argue about expanding Medicaid. And we know Kansas just recently did some of that. They've kind of expanded their program a little bit. And I hear rumblings once in a while, even though I'm not in the know, of whether or not we're thinking about doing that in Missouri. What do you think about that? What would the Missouri Budget Project say about that?
Sure. It's a decision that Missouri has to make. And so far, the state legislature has chosen not to do that. Kansas is looking at it and looking at some budget holes, and they've decided to go forward. And that may sound strange. What do you mean that they're covering a budget hole by expanding Medicaid? But we've done some analysis along with the departments of social services and the Office of Administration, the people that look over the budgets. And if we were to expand in the state of Missouri, we would actually have more money to spend on education or roads or what other priority there may be. And that may sound strange. How do we cover more people and then have extra money left behind? And it's because we would cover people that right now we're providing services to, but we're spending state-only dollars. So a lot of mental health treatment is paid for by state-only dollars. If we expanded Medicaid, we could have about 90% of the cost of some of those patients paid for by the federal government.
Now, see, you're getting on some of my soapboxes, because I really believe that we have not done enough for the mentally ill. We have cut that part of our budget in the state so much that, in my personal opinion, we are very seriously underserving our people.
Yeah.
And I'm watching people every day that I see, on the streets of Joplin that I think that several years ago might not have been on the streets of Joplin if we still had some of those dollars and those monies available. And again, I don't have quite the solution, and I don't want to sound hypercritical of our state budget, but I'm thinking we've trimmed that a little bit too much. And so personally, I think if we could free some of those monies up, I think we'd be in a little bit better situation.
Well, I mean, the folks working with our populations with behavioral mental health problems and addictions and drug and alcohol problems are doing wonderful work.
Yes, they are.
But they are stretched extremely
Very thin.
And
Very thin.
simply because of the way that the system shook out when they cut Medicaid back in 2005, it left a lot of those people with no services at all,
right,
or forcing them to go on disability, and that limits the amount of money that they can make, and really it limits a lot of possibilities for them. And some people are actually forced not to work so they can stay on disability just so they can get their mental health treatments or their drug and alcohol treatments. And I think everybody in the state of Missouri understands the power and the need to work if they can. And we shouldn't have government programs that force people to stop working just so they can get treatment.
Exactly.
And Medicaid expansion would help that. It would allow people with needs for mental health care, behavioral health care, or drug and alcohol treatment, they could earn a little bit more money. The federal government would help to pay for their treatment instead of the state paying for it. And I think that is probably the population that would benefit the most if we expanded Medicaid.
Yeah. Now again, that doesn't solve the problem. Is how is the federal government going to pay for it too? And I do understand that. Yeah. Okay. And again, my whole point is that I always get frustrated in the conversation anytime the conversation just comes back to is what's going to make life easier for me. That's when I start to get uncomfortable, because then I'm starting to say, well, wait a minute, this isn't just about me.
Yeah.
I know that I matter too, and it's not that I'm trying to throw myself under the bus. But for me, that seems to be part of the conversation about a larger community. How do we as a larger community figure out how to grapple with the problem that we've got folks among us that are sick or not getting care?
Yeah.
And how do we fix that?
Yeah.
And I know it's a complicated equation. And that's why there are people like you sitting around trying to crunch numbers and trying to advocate for some of those things.
Sure. Well, and we did look at the numbers, and there would be a significant amount of money that we could use federal dollars to take care of the needs of those folks, but also it would free up that general revenue I was talking about, that portion of the budget that we can decide to spend on certain things.
Mm-hmm. That we need.
Sure. And so, strangely enough, the analysis showed, and it shows in other states where they've expanded Medicaid, that they've freed up dollars in their budget to spend on other things. So that's one good thing that I think we should probably look at. And I think that we have a conservative legislature. I understand that. Personal responsibility is very important to our legislators and those who are making decisions. But some other conservatives, governors, have gone ahead and expanded Medicaid. Our Vice President Pence in Indiana expanded Medicaid, and he used some kind of reforms that helped with people making sure that they felt that they had skin in the game. They felt that there was some private responsibility or personal responsibility taken by those recipients of that insurance. And so I think there's conservative solutions that we can find if we can get back to the table.
Right.
One of the things I've hated the most about the Affordable Care Act is that it seemed to me that the Republicans kind of decided healthcare wasn't something they wanted to work on anymore. And we desperately need both parties at the table. We desperately need Republican ideas, conservative thoughts, and figure out how to kind of come to the middle and make a system work together. If we don't have everybody at the table, some new ideas out there, we're going to be at a loss of how to fix things. So I'm glad that at least in some small spaces, we're getting people talking together. We're hoping that becomes a broader space. And in Kansas, they seem to be thinking along those lines.
Good. Well, we take in Kansas here in a part of our viewing area.
Yep.
So, which really, if any of you folks on the Kansas side want to come talk to me on TV for a Sunday morning, you need to let us know, okay? But I just think that again, that whole idea of getting everybody to the table is pretty essential. It's one of the things that our show, Faith in Our Hometown, was founded on. Is that we think we're better together when we're talking about ideas and those things than we are than when we're sitting in our own little silos.
Yeah.
Because if we're sitting in our own little silos, here in Joplin, for example, Catholics are 4% of the population. What good am I going to do sitting in my own little silo? But if I get into conversations with people in other ways, even people that I'll disagree with, we might be able to stumble upon some new ideas for fixing some of those things. So real quick, if we were going to advocate for things in our area, what are some of the things you should talk to? Whether we're Republican, whether we're a Democrat, whether we're independents.
Sure.
What should we be advocating for? Do you think to the people we help elect?
Well, number one, because I'm a health policy guy, I think that we need to protect that relationship between the federal government and the state government, and that partnership that we have. And we want to make sure that that remains the same, that the federal government remains a partner in our Medicaid program, because these are really, really important dollars, and they're really, really vulnerable populations that they're helping. And so making sure that at the federal level, they don't change the relationship with the states and force the states to go it alone or go it with a lot less. We think that that would cause problems not only to our healthcare budget, but to our education budget and our prison budget and every other part of the state budget. That's probably number one.
Okay, so we've got to make sure that we want our folks to stay in the game with the federal government to make sure that they're continuing to work together to make a common good for all.
Make sure that partnership with Medicaid stays as it is.
Okay, all right. Well, my guest this morning is Brian Colby, who's Special Projects Director that was hard to say, for the Missouri Budget Project. And we're going to be right back after this Mercy Minute. Don't go away. Stay with us.
Find out how a Mercy doctor can take care of you. At Mercy, your life is our life's work. Quality, safety, and an exceptional patient experience. Mercy is grateful to be recognized as one of the top 15 health systems in the United States. At Mercy, your life is our life's work.
Well, thanks for sticking with us this morning. This morning's topic may have raised your blood pressure a little bit as you were enjoying your Sunday morning coffee, and if it did, I apologize, but not really, otherwise I wouldn't have done it. Okay? So we've been talking with Brian Colby, who is the Special Projects Director of the Missouri Budget Project, and we were just talking about some of the things. They're an advocacy group and really been advocating in a lot of ways on how we can improve our health care system in general. And we talked a little bit about how to do that from the federal side. We talked a little about how to do it from the state side and some of the ways that we might do that. But I think the important thing that we stumbled upon together was that we got to keep the conversation going. And so if you're a Republican, talk to your legislators, the people you elected. If you're a Democrat, talk to your legislators and the people you helped elect. We've got to get everybody together at the right table. Otherwise, we've got less and less of an opportunity of figuring out a solution that's going to suit more and more people and get us there together. So thanks for joining us again. Come back again and join us next week. This is Faith in Our Hometown.
Thanks for watching. Faith in Our Hometown can be seen Sunday mornings at 6:30 and 9 a.m. on KSN. Brought to you as a community service and sponsored by Mercy Hospital, Joplin.